I'm Louise de Winter and I'm the Chief Executive of the Urology Foundation. The Urology Foundation is an excellent charity. It's the only charity in the UK and Ireland that actually funds research into all urological conditions. Urology diseases are actually increasing, and certainly as the population is ageing, and actually 1 in 2 people will probably suffer from some sort of urology condition in their lifetime, and that could be something as relatively minor as a urinary tract infection, although those can get quite serious if they're not treated, to something like a bladder cancer or prostate cancer. So the range is vast. The Urology Foundation is actually really in the vanguard. We've always prided ourselves on being in the vanguard of looking at new treatments and new technologies, because we really believe that, giving people the skills, making sure people are skilled up, making sure we've got the research that increases the knowledge, is the fastest and surest way of getting better treatment and better care to the patient. So it's all about how we help the patient faster and more effectively.
Well, a lot of people ask me where the money goes. We work hard to raise the money. I think last year, thanks to our excellent CEO Louise, we raised about £1.3 million. So where does that money go, and is it really well spent? Well, I can tell you it is well spent, and the money goes largely to fund research. Research is where the breakthroughs in the management of prostate cancer, bladder cancer, kidney cancer, and non-cancerous diseases that affect so many people, incontinence and other problems of patients suffering from urological disease. So that money goes to developing new treatments, new diagnostic techniques, new markers, new preventative measures for all these important and very common cancers. But it also goes to educate urologists in terms of training them to be better surgeons, training them to be better diagnosticians. And we do quite a lot of personal development for doctors to make them just better doctors in the way that they deal not only with their patients but with their colleagues, and the way that they function within the hospital system to make them, I think, better professionals. And the Urology Foundation does exactly that. We train doctors to be better clinicians, to give better care to their patients, and to be more professional in the way that they do that.
That's why we've also funded a lot of training in robotic urology surgery. We have fundraised enough money for us to create 5 centres of robotic urology training in England. And so from going forward, there will be hospitals in London and Bristol and Kent and Canterbury and in Newcastle, where they will be Urology Foundation centres of robotic training, where we will be able to put more surgeons through robotic training, which means that we can get robotic operations to patients faster and spread that knowledge across the NHS base in England, which is wonderful.